afternoon and welcome to Policing TV. I'm again joined by Rachel Tuffin, the Interim Director for the Centre for Police Productivity at the UK's College of Policing. Rachel, in the last video we recorded, we concluded with a couple of remarks about implementation. It's not just about the research, not just about establishing whether the initiative works or indeed doesn't work, and both are useful findings, but it's also then on rolling it out elsewhere, the challenge of implementation. And so let me ask the potentially naive, but I'm going to ask it anyway, question. Why does it take so long to roll out once the research and the work done has indicated that it's a great idea to pursue?
Oh, it's a great question, Bernard. And thinking about just a couple of examples, you could think of body-worn video. Took more than 15 years to roll out. Hotspots policing, even longer, I think maybe 30 years from when there was an original evidence base about it. So I think, obviously, as often the case, there's a combination of factors. Just people knowing about things, so speed of awareness, spotting them, knowing that somebody has started to do this innovation, getting alongside it quickly and encouraging them to evaluate. So I don't think when body-worn videos first started to be used, there wasn't evaluation. There was afterwards, but of course that delays if you've then got to test it. You know, you want to get the testing done as quickly as you can. Ideally, you do like multiple police forces as well. So you've got like different examples of the same thing being tested in multiple places, because otherwise you can get it may have worked for them, but our force is completely different type thing. So it's helpful to have like is there an average result across several organisations? Very helpful. So awareness, an average result, having a strong evidence base. So, you know, a decent quasi-experimental trial, so where you've got a comparison between a few areas and you've got pre and post, or randomized control trial where you randomize whether you give it, who you give it to, or what areas you give it to and which ones you don't, and compare the results. All of that can reduce the risk of getting the wrong answer. So an answer that later on turns out to be not the case because it didn't work in X or whatever. So you get strong evidence base. That's actually becoming more and more compelling, I think, in England and Wales. We've got more and more chief officers who recognise it really helps them with managing the risk of something not working. And so that speeds up people thinking, oh, yeah, I can see the findings there. They look robust and I'm interested in that. Then I think we've been missing a trick a bit, which is we don't provide enough detail about exactly how an intervention works and how you would go about implementing it. So policies and procedural documents and an actual blueprint or similar. So I think we've been doing more of that now. The national organisations, when they're helping with these things, are thinking, oh, right, yeah, no, we need to give more of a kind of a manual. I think we used to think, provide the high level findings, provide the kind of, you know, and then the forces can adapt it locally. Well, that's a bit of a kind of get out. Actually, forces could do with a whole lot more work being done to give them the detail that yes, they can then adapt it, but you've given them all the bare bones of the policy documents. That kind of stuff is actually really important. And then I think it's creating networks between organisations, because as they're implementing themselves, they learn all sorts of lessons that they can share with each other. Early forces, when you're doing this sort of thing, is probably a good idea for whoever can provide the support. So the first organisation, that's what we've been doing in the centre. The first organisation to try something, we get them buy out their time almost to help the next forces to adopt, and then gradually create a momentum and a network where they can all share findings with each other. They can continuously improve. So say, oh, I've tried doing it a bit like this, so I've tweaked it slightly. People can go, oh, hang on, don't tweak that bit though, because if you tweak that, that might actually go off beam and not deliver you the results you're expecting. So you create that kind of network, and then monitoring, obviously, that the results are still delivering. Sometimes it's kind of lack of a central place for funding. Sometimes you do need it. You need some investment up front. That can be an issue too. Not always, but it can be. And then sometimes also, I mean, you and I briefly mentioned right care, right person earlier, and that's an example where effectively Humberside police in England tried out a new approach to working with their partners, particularly in the area of mental health, to make sure that the right care was being provided to people. So effectively policing wasn't providing trying to provide support to people in mental health crisis, but instead people who have that expertise would. But of course, there's lots of complexity in that, and you need to kind of really build up the partnership in order for something like that to work. You can't just kind of press a button and say, bang, we're going to implement this. So there, lots of work. And then I think maybe my final thing, and you might have thought of a few more while I've been describing those, Bernard, is just bandwidth. So there's so much change in forces that I think people in central organisations and anybody who's got a specialist interest has to respect the fact that forces will have a whole programme of change activity. And you've got to find the people in the force who are overseeing that, whether it's in technology or in process improvement in a force or in performance, and talk to them about their timetable and think about how this could fit with what they've got programmed in their force. Because there's only so much, obviously, any organisation can do to change in any one financial year. So if you're working within that period, you need to think about how you can get the thing that you think is good to prioritise network to all the forces that might be able to adopt it in any one year.
One quick question before we wrap up this video. Certainly, a number of years ago, there was a strong "not invented here" attitude. Do you think that attitude still pervades in any way?
I think it's much less prevalent than it was. I think as I said, I think officers and staff, people at all different levels, I think they're quite clued up to the fact that you can innovate by taking an interesting example from somewhere else that's already been tested and then bring it into your organisation. That's still innovation. So if you want to be doing something new, it doesn't have to be. You can adopt with pride and adapt with pride if it needs any adapting to fit in your circumstances. Again, with that caveat about if you change it too much, sometimes it won't deliver what it did when it was previously tested. But I've seen some great examples where forces have taken an idea, even where it's just an idea actually sometimes, they've taken an idea they've heard about from another force, which maybe hasn't even been progressed in that force yet, and then they've thought about, oh, we could add something onto that actually. What about if we tried that, but we also made it an online version, So I think actually it's much more grown up, much more mature. I think our environment these days about going, yeah, I think we can try that. We might even be able to improve it a little bit.
Perfect. Rachel, once again, thank you very much indeed for your time.
Thanks, Bernard.